The first thing I think all of us can do in the field of MS is when we're thinking about primary MS prevention, meaning if we want to know what causes multiple sclerosis, I think we have to be really mindful of this prodromal phase. You need to consider this prodromal phase or this potential prodromal phase very carefully, so you don't inadvertently confuse something that you think may cause MS when that individual is already in the prodromal phase of MS. And I think it's really gratifying to see that studies that are being published in recent years are starting to take on board this concept of a prodromal phase when they're looking for risk factors for what may cause MS. Now, of course, findings also suggest that there's an earlier window of opportunity to identify people with MS. Now, we obviously have a long way to go before we can do that, because a lot of the signs and symptoms I've been sharing with you are very common in the general population. But if we could harness this information, it would be really to identify people with MS earlier, could be really impactful on the individual. It could alleviate uncertainty of that person with MS as they're seeking an answer or a diagnosis for their kind of non-specific signs and symptoms. Maybe it could enable prompt management of MS and prompt initiation of disease-modifying therapy, which we believe is important. Perhaps we could be in a position where we could identify people in the prodromal phase MS with a certain level of certainty. Of course, we'd have to combine some of the signs and symptoms I've been sharing with you with other factors, say an individual's age or sex, family history of MS, other biomarkers, should they be available. Maybe we could then offer those individuals enrolment in novel neuroprotective clinical trials, similar to what's going on in radiologically isolated syndrome, but maybe we could offer this to a broader group of individuals. Of course, the big caveat here is that while we all want prompt recognition and diagnosis of disease, we really want to avoid over or misdiagnosis of disease. And that's already a problem in the field of MS already. So I think, in short, this concept of a prodromal phase in MS is really exciting. I think there's some way we need to go before we can use any of these findings in clinical practice. But in context of thinking about risk factors for MS and what causes MS, this is really important, and a lot of future opportunity with additional work to maybe identify people with MS earlier.